The first thing we're going to talk about is the use of a Radio Shack infrared thermometer. Obviously, it's a really fast thermometer. It works very well. You put it on your finger. That's the temperature of my finger. It's 90 degrees. And here's my palm. It's about the same. There's 91 degrees here, 91.5. And then you can say my temperature here, and my forehead is 92 degrees. You can see that it's a variable temperature. We use the axillary temperature then, and we use also, this would be the axillary on Scruffy, just up underneath the arm, and you'll get normals that way. You'll get the normal axillary temperature, so you don't have to do rectal temperatures, because that also causes problems with vagal as well as sympathetic discharge, and we've had some animals that have been sitting there huffing and puffing and having trouble breathing and then fall over because of the vagal responses that these dogs get. So not necessarily should you do rectal temperatures, certainly in patients that are having difficulty breathing. But if you want to know what their temperature is too, you can also use the buccal area of their mouth. It's also very effective. And of course the very tip of their forehead. Those three areas, tip of forehead, buccal area of the mouth, and axillary. Those three areas are easy to get to. And of course, if you have a patient, for example, you think is painful somewhere, but you're not sure where the pain is. Let's say it's belly referred pain, but you got a dachshund, for example, you think it's probably his disc. You can actually then surfacely look at all the different areas of his body, and if he has an area that's more hot in terms of inflammation, you'll pick it up. It's a thermal scanner, if you will. I'm a volunteer firefighter. We use thermal imaging, for example, for finding hot spots in buildings. This is thermal imaging to find hot spots on the dog. It works very, very good. And it's about $50. You can find them for even less than that, but this is the one that's Radio Shack. You can also find those that are infrared, that are laser guided, so you can kind of like even be far away on a mean dog and find out what his temperature is closely, okay? So these are very handy. I would say highly recommend not rectal temperaturing anymore, because it's at high risk for the owner holding as well, because there's a little more like want to bite and move and scream and all that, and it's great for cats and all birds and little animals, where you thought, well, how am I going to get their temperature? Axillary temperature. Oh, find out if they got a hot spot anywhere, things like that. We're into light, okay? We're going to use, this next is a form of light. This is essentially a 660 nanometer light. And it makes, essentially the light is about 5 diodes that are in that light. And it gets, again, a pure, basically red light, near infrared. It's on the almost near infrared spectrum. So it has a unique ability for when you're putting it on the patient, for example, their forehead. There's a very, very top of the forehead right here on a person. It really calms them, and especially the ones that are also behind the ear. These are acupuncture points. It stimulates the acupuncture point. The acupuncture point is related to where light chemistry, we're talking about biophysics now, and how this really works. Acupuncture points are actually just windows into the body related to light. We are more light matter than we are particle matter, and that's been shown by the biophysicists for quite a number of years. Well, so we use this light in different areas, and a couple areas that are really important is right here at the axillary, right here in the arm. So this is complex to you right here. It's in this place right here. And this acupuncture point, well, if you will, is a place that's, again, a light frequency enhanced. What it does is when it gets the collagen bundles under the skin, it's like a piezoelectric crystal, and it sends out electrons, and if you will, electrons that are paired electrons. These are covalent electrons, and these coherent electrons essentially stimulate the body's chemistry to make endorphins. And that's how we know it works. So it's the underlying basis of biochemistry in the body. It's biophysics, and that's really how acupuncture and aculight, if you will, here works. So we can use it also in areas that are painful. Let's say it's that dachshund. We lay that light along where his pain is, and it would increase blood flow to the areas where his pain is. That takes pain away, the ischemia part of the brain, as far as the blood flow to that area where it's painful. It also releases endorphins in the hypothalamus, related to then the light chemistry that's going on in the body. Now, I'm not a biophysicist, but I've been working with one, and I've been learning a lot. But it's related to, we've got several kinds of chemistry that are flowing in the body. We have blood flow, We have lymphatic flow, we have cerebral spinal fluid flow, and we have light flow. And the light flow are in the meridians, which the Chinese have done all this meridian work, and they found out that's where most of your light flows are. And so if you look at light, this is a special kind of light. It's a light that uses quantum tunneling to be able to get into the different tissues and it speaks, if you will. All cells speak back and forth to each other with this form of biophysical electromagnetic frequency light. Okay, so I guess that's all I'll say about this, but it's used very, very handy. I got this from Australia. Brian McLaren is a veterinarian down there, and he has canine photonic therapy. It works very, very good. I can take a patient who's screaming, and this has happened many times, and who's out post-operatively, and he just hasn't got the drugs yet that he needs, and I'll put that light right here on the top of his head. Within usually a minute or less, his endorphin level is now saturated through his brain, and he goes to sleep. Now, you need to keep the light on for longer periods of time if they're really revved up. So, don't just say, oh, it's not working. Leave it sit on there for a while. And there are, again, other points that will also release endorphins. One of them is great for insomnia, by the way, for humans. It sits right here in the back of the head. I can tell you this from personal experience. And so the light basically goes in, discharges its light, basically go into the hypothalamus, and locally as well, and produces... by the way, it's when you put it in the right place, it makes you yawn. Or it takes you to make a deep breath. And we see this with the patients. You put that on and they'll go, huh. And they'll sit on an exam table and they're trembling and they're scared. And all of a sudden they go, oh, not so bad. Then the owners will say, what'd you do, doc? And I'll say, we just put this light on. And he says, what? And I say, yep. And the animal owners that are there present, if they're having trouble with the dog screaming or something from pain, we'll put it right at the top of their head and we'll see them go to sleep. Or at least calm way down. And I'll say, hold this light here for me, and they'll do the rest of my exam and see them, okay? So this is basically out of, again, photonic therapy for animals. It's out of Brian McLaren. It's out of his website is, I think, caninephotonictherapy.com. And it's out of Australia. Get the one that's .com.au, because it takes you right to the Australian website. The next thing, while we're on the subject, is this is a new device. It's been published, just recently, FDA approved, December 12th, in fact, is when it was approved. And what it is, it's a little unit that sends out an electromagnetic signal all the way around. And this is called the VV. It's IVIVI. I don't know if you can see that from your camera, but that's the name of the company. And just recently, it became approved for pain relief. And my real good friend Joe Thompson is the one that's selling these, and he's selling it through muscular therapy for animals. And so if you go to his website, I think it's mtavet.com, www.mtavet.com. And what it's doing is sending out electromagnetic signal, and I'm using this little device here to kind of show you that that signal is working. You see it's kind of turning into a little flickers. That's telling you that there's a biomagnetic signal. And beauty of what's happening is that the FDA approved this as the first electroceutical for pain. And by the way, then if you have a headache, here it goes. And most people, within 90% of the people, their headache will be gone. How does this work? Well, what it does is it takes calmodulin in the body. I'm going to turn this off, by the way. Okay. It takes calmodulin in the body. It locks it into calcium. It's an electromagnetic signal that does that. It's light. It's a light-based signal. And that light-based signal, and again, underneath the biochemistry is the light and the electromagnetics. Then we get to the cells themselves. So the cells then become turned on to take calmodulin in their body, in their cells, and attach to calcium. When that occurs, you get an increase of eNOS, which is the endothelial-based nitric oxide synthetase. And that then turns on, and you get lots and lots of nitric oxide. The nitric oxide vasodilates the area where it's at. So recently they did a study in humans where they put the loop 10 minutes or 20 minutes twice a day over their chest area where their heart was ischemic. They had ischemic cardiomyopathy. It was published 2 weeks ago in a poster session at the cardiology meeting, American Cardiology meeting, and it was unbelievable. These kids, these adult humans with heart failure that was enough they could only walk a few steps before having trouble. Shortening fractions were really bad. They did SPECT imaging on these prior, before, and after, and it essentially showed their hearts getting more fluid, more blood flow, and their hearts getting stronger, and these guys came out of heart failure. This is a phenomenal thing, and it probably could. This is a device that could win the Nobel Prize. Because think about it, you've got pancreatitis, you lay it over their abdomen for ischemia. You got very bad pain in your knee. And I personally used this when I had back surgery 9 weeks ago. Okay, had a major back surgery, and I put it right here on behind my back, and it took my painkillers that I needed. I was on Dilaudid at about 6 to 8 milligrams, and it dropped it down to 3, then to 2. Okay, because it actually it decreases swelling, decreases edema, decreases inflammation. IL-6 and IL-8 are all decreased, and thromboxanes are lower, and the blood flow is getting better. So any place you think you have an ischemic disease, you would use this. Besides, I use both together because this is also a vasodilating agent as well. You think about it, both of them work a little bit differently, but they work in the same at the subcellular. It's monoatomic. It's really a monoatomic system. Now that's what we're all based on. We are monoatomic. If you want to just cheat a little bit, you don't have to use this big light. You could also use just a regular laser light, for the wall here. Okay, you can see that the light's going through my finger. Okay, that tells me there's enough power there that it's actually then getting the acupuncture points. You just have to be on there longer. This Dr. McLaren has a total website that is devoted to education of why this works, so I would rather highly recommend you go there. And we're using it as clinical trials now. We're a beta site for them out there in California, and we have roughly 20,000 patients a year come through that emergency practice. And I used it recently on a dog who had a very severe head injury, so he got the Aviva unit put on twice a day to help increase his blood flow, and he's made tremendous recovery. He's not there yet, but you can also take this home. The owner can take this home. So if you can have this available for animals. It went through the FDA, so you can use it for our. I wouldn't suggest putting the dog right in the middle. There's a little tiny dog, because it may vasodilate him completely. We don't know. Okay, but they're starting to work with the loops that may be also used for complete pain relief around the body. So we have this that potentially could be used any ischemic disease in animals. Let me throw out a couple others. This inflammatory bowel disease is somewhat ischemic. What about liver disease, chronic active liver disease? Any place you think, now that the device, as long as you have it in a circle, its electromagnetics goes out about two-thirds out from the circle. So if I use my little fingers here as my chronometer here, and say that's 2/3 of the inside of that circle, that means it's going out that far and that deep. So it's at least got the depth you need to be able, in humans, to make their chest, of course. What we don't know in animals is we don't know, is this same fit in animals as it has been in people. But you can imagine, so far, everybody's really getting excited about this because it's the first electroceutical, and it doesn't seem to hurt patients.